to the Croydon Vision Facebook Live event. With me today I've got David Barker, and he comes from Rollings. He's one of the directors in Rollings in central Croydon, next to the post office if you want to know where they are. And he's going to talk about eye health. So welcome, David.
Hello,
it's lovely to have you here, and obviously we're going to hear from you very soon.
And hello everybody, it's Odette here, and just wanted to find out if you were here last week, if you enjoyed Marsha doing the Christmas cards. We had a few examples, and we had a card. Who did we have a card from? From Anna Clements. Yes. Did you actually do some cards yourself? It'd be nice to know if it gave you ideas to do different cards. And it's really fun to do homemade cards. And I think that people who receive them really appreciate the kind of personal touch. So I hope you enjoyed last week's Christmas card making.
And now we're going to not waste any more time, and we're going to ask David if you would like to start telling us about eye health. I believe the first topic is dry eyes.
Hello, thank you. My name's David. Thank you for having me as well. It's very nice to be here. So there's a few range of topics I thought I'll talk about today. One thing is, if anyone's got any questions as I'm going along, feel free to put them in the comments bar, and I'll answer them perhaps as we go along, rather than just me giving a long lecture. Certainly dry eyes is a very common condition. It affects women a bit more than men, but age is certainly a big risk factor, so as we get older we're much more likely to have dry eyes. And certainly in lockdown I've certainly noticed a lot more people complaining of dry eye problems. Unfortunately, prolonged screen use doesn't help, lack of blinking doesn't help, everyone's been stuck at home on their screens. And when you're on the screen a lot, your blink rate really goes down a lot, so you hardly blink at all, so you're just staring, not blinking, and that blinking is what pushes the tears around and keeps the eyes lubricated. Common sort of symptoms would be gritty, sore, bit sort of crusty, sort of gritty is a common feeling. Even watery eyes, because sometimes the eyes actually water because they're dry, and so it's too much or too little. So what you really want is a nice even tear film, not too much or too little. And a common condition with that is when people go outside in the cold, their eyes stream, because the wind's irritated their eyes and it's caused the eyes to stream. And that people get really confused because they think dry eyes, no tears, but actually watery eyes can be quite a common condition.
And what happens, David? What happens if you don't treat it? Sort of what does it kind of do to your eyes to have?
It's not sight-threatening or serious, but it's a real common complaint that we see. I mean, every day I'll have 2 or 3 people complaining of dry eye problems in my practice. It actually makes you quite. It actually affects your quality of life quite a lot. In fact, believe it or not, I think there was a study done where it showed that dry eye problems is about, if you look at quality of life, it affects you about as much as angina does.
Oh wow.
So people actually get quite worried about their eyes. There's a few things. I mean, if it's a simple dry eye problem, it shouldn't be affecting. It's not going to affect your vision. It's not going to make you really see badly. If you have that sort of symptom, that's something else you need to get looked at. But what we'd probably advise for simple measures, just something you can do it yourself at home. Regular blinking, so if you are on a screen a lot, we sometimes say like 20-20-20 rule. So every 20 minutes, you should look up at something 20 feet away and blink 20 times, quite sort of vigorous blinking, because that blinking is what pushes the oils and the parts of the tear debris around. Drink lots of water, regular breaks. Another common problem is the oily glands in the eyelids get quite thick and blocked. So we would suggest warming the eyelids, so maybe like a gentle warm flannel, or you can get from chemists and opticians, you can get masks that you put in the microwave for 20-30 seconds, and again you keep that on the eyes, and then afterwards you gently massage the eyelids. I suppose the main question is if simple measures, and you also, the other thing you can try, just lubricating drops, which you can get from chemists or opticians. But I suppose the advice is if simple measures aren't helping, then you should get someone else to look at it.
And
when should you stop putting your eye problem down to dry eyes?
If it's not helping, so if symptoms aren't getting better, or you're getting unusual other symptoms, so if your vision's going blurry, or pain, or dry eyes is a nuisance. It shouldn't be it's not something that for most people, yes, you can have severely dry eyes, and that can be a real problem. But there's usually other things going on as well. But if it's mild dry eyes, it should be minor symptoms, and it should get a bit better by doing simple measures. If it's not getting better, then yes, then you should need someone to look at it else.
And David, what about makeup or kind of beauty products like face
Doesn't
creams?
Mascara doesn't help.
Yeah.
I see lots of mascara over the eyelid glands. Cleaning makeup off is important. Obviously, you don't want irritants to affect the eyes. We see all sorts of issues with things like I've had several people come in with false eyelashes, glue.
Yes.
The glue they use causes irritation. In extreme cases, really bad reactions. Actually, personally, I'd avoid
any glue.
I'd avoid glues.
Yeah.
You get tattoo stuff done, all sorts of weird stuff now.
Yeah.
David, what about being a contact lens wearer? Because I wear contacts, but my opticians have advised to minimise your time, staring at the screen, for example, at work. So when I get home, I tend to take my contacts out.
It's a good idea if you are at home. I mean, a lot of people in lockdown have not been wearing lenses so much, to be honest, because they've been stuck at home.
Yeah, that's true. Yeah.
But certainly, contact lenses again. It's the same with the screen, really. If you're staring a lot at the screen with or without contact lenses, they'll dry your eyes up a lot.
Right.
So regular blinking is, even with contact wearer, we would often say regular blinking, and just being sensible, really. Yeah, it's just if you are at home and you're not going out somewhere, it's good to give your eyes a bit of a rest as well. So.
Another question I had is that if you do have dry eyes, is it okay to go swimming in the swimming pool because of the chemicals there?
Chlorine can be a little bit bothersome, so if you have got good goggles, it's not a bad idea. I think if you've got very dry eyes, it won't do damage, and it's still good to be, probably better to be active than inactive.
Yes.
But
you put drops afterwards?
You can put drops in afterwards, lubricating drop. Good goggles would probably be a good idea if you've got very dry eyes, because the chlorine might irritate a little bit, so that's certainly a good thing to think about.
Thank you.
Good. So the next thing I was going to talk about was myopia, or short-sightedness. Might be a bit of a technical term, and it's not perhaps widely known, but myopia really is where you can't see things close up. So you can see things close up, but you can't see things far away. So a lot of people say they're short-sighted, but actually they need reading glasses, which is not the thing. It's short-sighted when you can't see things far away. Unfortunately, in children particularly, we are now seeing a big increase in short-sightedness or myopia. I think about 20% of children now are short-sighted, and that's doubled in the last 50 years.
And do we know why?
Yes, do we know why? Yeah.
Well, there's probably a few things. Certainly family history is important, so if you have short-sighted parents, you're more likely to be short-sighted. If you go out to the Far East, it's probably 70-80% of kids are short-sighted. It's massive. Probably part of the equation, unfortunately, seems to be less outdoor play, so more kids play indoors, not outdoors. So outdoor light is thought to be protective and helps. And unfortunately, increasing screen use is also probably a factor. Unfortunately, more kids now are playing indoors, staring at screens.
Would you advise parents that it is a good idea to set a healthy limit on the amount of time that their child's playing video games and
that's a very good idea.
Watching television
And then would it be important for the children when they're playing to actually gaze far away and close up and change?
It's a good idea to look far away.
Yes.
It's a good idea to play outside.
Yes.
We think probably about 90 minutes a day outside play is good and helps. For some reason, no one really knows why. Vitamin D, UV, no one really knows why, but certainly we know that playing outside is important.
And of course we know that playing outside is also it's good for
It's healthy for them
lot
as well.
of
It's not just eyes. It's good for you
eyes,
generally.
it helps to reduce obesity,
Mental health, everything.
mental health. So
Everything.
playing outside, definitely playing outside.
And certainly with children, I would always encourage parents to get their kids' eyes tested, and from a young age, you know, we see kids from babies on upwards, but certainly 2s, 3s, 4s. It's not too early to get their eyes tested. And luckily in Croydon, we actually do a school screening where reception year kids do get an eye screen.
Oh, that's very good.
And that's the school nurse does that, and then if the kids fail that, then they come to see us. And we see a lot of kids with quite poor sight at the age of 4.
Gosh.
And I'm seeing a lot more young people going short-sighted now, unfortunately, at a young age, which is a bit scary because they're going to end up quite short-sighted. And what we also know is that the more short-sighted you are, unfortunately, there are associated with other eye problems like glaucoma, macular degeneration, retinal problems, retinal detachments are much more common in short-sightedness. So if kids are going more short-sighted, unfortunately, as they get older, they could well have more problems.
So when you get a child who comes into your practice, do you actually recommend that they go and play outside and all that? Can you actually reverse what I'm sort of trying to come?
You can't reverse short-sighted. No, unfortunately, once you've gone short-sighted, you are short-sighted. What you're trying to do is slow down their short-sightedness. There are other options, and I won't go into this at the moment, but there are other things that can, and certainly new treatments that are possibly coming out. Drops may be an option. There's trials at the moment in Moorfields, London and Northern Ireland on something called atropine drops. Contact lenses are being used for short-sightedness, slowing down. So not reversal, but can you slow it down? And in some of the studies, they're up to about 40-50% reduction in short-sightedness. So there are things out there. But I think for young children, if they're not short-sighted, the best advice is play outside, limit screen time. They're really the two keys. And have a regular eye test as well. But certainly it's a problem. And unfortunately, it's not going away either, unfortunately. So parents, really, the best thing they can do is try and limit time. I mean, screens are here and we're all using them.
And toys as well, unfortunately.
Yeah, but it's just not doing it to the, you know, it's doing other things as well. So it's turning it off and getting them outside if you can.
As well, it's a message to the schools to make sure that, again, children of school age in school are not spending too long in front of a lesson, that they mix up the lessons.
Unfortunately, I've had several parents come in and say, well, because of lockdown, you know, obviously they've been doing all homeschooling, and because the schools have found that useful, now all their homework's done on the screen as well. So they're being set all their homework on the screen. So they basically probably come home after school and sit there for another hour or two doing their homework.
So really it's a message.
And then they're probably then doing a game or watching a
television.
I know.
So really, we maybe need to sort of start saying at a higher level to the schools that they do need to start mixing up.
It's mixing and matching, The screens are here and we're going to use them. That's not going away, but it's just not using them to the detriment and everything else, really. Being careful, really, I guess, is the question. Good. So the next thing I was going to talk about was macular degeneration. Not so much, perhaps, I mean, I'm sure you've all heard of macular degeneration, or there's varying types, so I wasn't going to get too much into the technical side, but just are there anything we can do? So macular degeneration in the age-related, which is the common type, affects the central vision, and it's a sort of wearing out of the back. So the peripheral vision's good, but it's the bit in the middle. Reading, obviously, all those sort of things are difficult. So there are some associated factors. Obviously, age is the biggest one, and not a lot you can do about that one. But things like smoking is important. So we always suggest people don't smoke. I think you're about 5 times more likely to have macular degeneration if you're a smoker than a non-smoker. So stopping smoking is a very good thing to do, not just for your eyes, but for everything, but certainly for eye health it's very important. And even if someone smoked for 50 years, actually stopping is still a good thing.
Does it still slow?
Yes, I mean you can't, again, reverse damage has happened, but it probably slows it down. So even if you stop smoking at a later age, for your eyes it's still a good thing.
Could I just ask you, if you maybe don't have age-related macular degeneration, if you maybe have had something else happen with your macula, is it still good to say stop smoking and
Well, even if you've had something else, you can still get macular degeneration on top of other conditions.
Okay.
So just because you've got one macular condition doesn't mean you couldn't also get a different macular condition. So you don't want to increase your problems.
Yes.
So yeah, smoking is a bad thing. So we want anyone who does. I mean, obviously a lot of people don't smoke so much these days, but if you are a smoker, it's a good idea to give up.
Yeah.
Diet is important. So lots of normal, good, healthy diet is important, but particularly things like green leafy vegetables are good. They're high in things called luteins, which are macular pigments, which certainly are a good thing. Spinach, kales, peppers, all the bright vegetables, bright colours, and a good mix of vegetables as well, obviously, is important. So that's certainly important. UV protection is important. So again, hats, sunglasses are important as well.
So would you advise somebody with AMD, because there are some on the market I know, to go and get yourself a really good pair of overshields, which are also the same sunglasses. A really good pair of sunglasses.
Definitely, overshields are very important, because again it blocks all that glare around.
Yeah.
Small little sunglasses aren't going to really give you that sort of glare protection.
Because I know I wear overshields when I go out, and as you say, they keep all the light out. I actually went to Optilec and I got a really good pair. Made sure I had the right colour that was really good for me. I made sure that I had all the UV blockers and everything like that.
Yeah, that's certainly a good idea.
And David, if people find that sunglasses is sometimes too dark and it cuts out the light, can you get clear glasses that are UV?
You can do. I mean, you can have, if you wear spectacles and you don't like tinted spectacles, you can have a UV blocker incorporated into a clear.
And that would protect your
It would have a very slight yellow tinge to it, but you wouldn't really notice it, to be honest, on a normal.
Fantastic.
So it would have a very light yellow tinge, but you wouldn't notice it, to be honest.
But it's actually worth saying, while we're talking about overshields, that I certainly know with my eyesight, and the Guide Dog Association told me this, that some of the overshields actually help the contrast.
Some
they
definitely
actually help you see better.
I get patients who actually feel they see better as well.
I actually see slightly better.
Contrast is important. Because if you're out somewhere and there's lots of light, you lose every detail of everything. And actually, they're probably polarised as well, which also again is good for contrast and good for clarity.
I know that the Guide Dog Association even advised me to try watching the telly with them on.
Yeah, I mean if it helps, that's fine. One thing I would say with macular degeneration, if people have got AMD, obviously if anything changes quickly and suddenly, then again it's very important they get checked out, because a lot of people have got what's called dry AMD, which is a very slow, gradual condition, but about 10% of people with that will convert to wet AMD, and the classic sign is lines suddenly go really wobbly. Yeah. And it's good to cover each eye just to check. So if you cover one eye and look at I tend to tell people to look at door frames, so look at the door frames, it still look nice and straight, and again cover the other eye, and again does it still look nice and straight. And if they look and then suddenly there's a big wobble or a kink that wasn't there before, and they might, if you have AMD, you might have a little bit of a minor distortion, but if it's something completely different, then that's quite important they get that checked out.
And what should a person do? Should they go to Moorfields and Old Street?
You won't be able to go in straight away. So I mean, the most important thing is you go. We can come to this later if you like, but if you're in Croydon, the best thing is to go to one of the COS optometrists, which is a accredited list of optometrists, and then they can, if there was a problem, we can refer directly into the correct clinics.
So they would need to then go through the GP and wait?
I wouldn't go through the GP, it'd slow everything down. So basically, if you had wet AMD, ideally you see within 2 weeks, and we would refer you to a rapid injection clinic, which would be seen usually within 2 weeks. Whereas if you went to the GP, that slows everything down.
And in fact, I certainly know from my experience that a GP will tell you, we can't refer you to the hospital, you need to go to an opticians and get them to.
In Croydon, that's generally what would happen. Now, most GPs wouldn't refer directly, because really it's not their job, and they don't really understand eyes well enough to know which clinic to send you to or what urgency. We can put a link actually to the COS website on this Facebook Live link. We can do that, and that will have a list of all the opticians who are accredited, and go to if one of those is your regular optometrist, I would suggest go to them because they'll have your history. But if you haven't been to one of them and you need to go, then go, the nearest one to you would probably be the best place.
And if you find it difficult, just phone Accordion Vision, and we'll send you the list, and we'll check the list with you.
Yeah, good. Yes, we can. I'm sure you can pass that on if people.
So I've got a question about Macular. Because I have a member that I'm currently trying to help. She's got black spots.
Yeah.
So it's kind of hard for her to make out any sentences. Is there any tech or anything that you can use to help make that, or make it possible for her to be able to read? Because we've tried magnifying glasses, electronic, and the manual ones, and it's just the black spot still remains, so she can't form a whole sentence.
Right.
There is something, I think that's called eccentric viewing. So the Macular Society have people that train you to kind of use the periphery of your vision.
Yeah, Catherine was saying something.
Yeah, so instead of looking straight ahead, for example, myself, I use it all the time. I haven't got the center of my vision, so when I look straight ahead, I don't see. There's like a blind spot in the middle, so to speak. So I have to put my eyes down at 4 o'clock, and that brings the better bit of my peripheral vision in the middle. It's not as good a vision, but it does help you to be able to then kind of, there's a kind of a way to read by sort of keeping your eyes there, sort of moving the text in front of it. Or even when I look with a magnifying glass, I have to put my eyes sideways so that I can then read with it. Because even with a magnifying glass, if I look straight ahead, I don't see it. So maybe she can learn, she can sort of see if that technique can help her.
The question would be, how do you teach them to read with the...
So the Macular Society have a technique, I think there's about 5 or 6 lessons, and bit by bit you learn how to do it.
Is that on their website?
It's on their website, and I was trained as a trainer, so I know how to teach people. So if somebody's interested in learning, please contact Accordion Vision.
I mean, certainly one thing that people do worry about with macular degeneration, particularly, well, there's a couple of things they worry about. One is quite common, it's called Charles Bonnet syndrome, which is where you get funny visions and colours or patterns, and people think maybe they're going, maybe having some, mental health issues because they think they're, going crazy. And it's very common, and it is really just the brain and the eye trying to function and show, and so it's a very common condition. And again, it's not anything to worry about. It's just normal, and it's not something that it's not doing any harm to the eye, and it's.
I've heard that described as being the eye's version of phantom limb syndrome.
Yeah, probably that's a very good way of putting it. Actually, it's the brain trying to sort of
make sense of the missing bits, as it were.
I had that once. I was rambling with my husband, and I said, "Oh, look at the nice blue car." And he looked at me and said, "That's a brown garden shed." I thought, okay. And if I had been put in front of a witness stand, sworn on the Bible, I said, "Yeah, blue car," and it wasn't there. And it can be very vivid. It can be very. You really think it's there, and I think people sometimes see faces. I think they see ghosts.
All sorts of things. All sorts of things. I know.
And I think
it's common.
It's common. And the best thing is actually to talk about it. I think once you accept it's there, your brain kind of realizes, this is not true. And it kind of, and there's different techniques that the Charles Bonnet Association have to calm it down. So,
and the other thing with the macular, I guess, is going back to your issue, is the way I tend to describe macular degeneration is that there are some worn out patches on the back of your eye, and there are good bits and bad bits, and it's trying to use the good bits and not the bad bits. And you're not doing any harm by reading or trying to use your vision in any, there's nothing you're doing. People, I mean, not so much nowadays, but certainly when I started in optometry, people used to get very worried thinking they were going to wear their eyes out.
Yes.
So I don't read anymore because I can't. I'm going to wear my eyes out, and that doesn't happen. It's best to use the vision you've got, as best you can, not to worry about things that you're doing because you're not doing any harm to anything. Don't worry about that. The next thing really that's a quick topic, was on eye drops, particularly in glaucoma, where if you look at the number of people that are 100% compliance, it's very poor. In fact, I think the estimate is about 50% of people are non-compliant taking their eye drops. It's a combination of problems. Some people struggle to get them in. Some people don't realise what's the importance of taking their eye drops. Some they sting. All drops sting a bit. But it is really important to keep doing the drops that you're prescribed. And just quickly, I was going to say, if people are struggling to put their drops in, Moorfields run a very good Know Your Drops advice help, which has got some videos on there. Again, we can put the link to Moorfields Know Your Drops onto the Facebook Live website. There's some techniques if people are struggling to get them in. Because what we know is that, with glaucoma, which is when the pressure can be too high in the eye, the drops work by keeping the pressure down. And it's very important to keep the pressure down. If you forget a few days, or you don't get them in properly, or half it comes down your cheek, then the drop's not getting into your eye and it's not doing the job.
And do these videos also show the aids that you can get to actually help you?
I watched it before I came actually, so just to make sure I remembered. There's a certain techniques that they would suggest, which is on the website. There's also use of aids, which I think you could probably ask your pharmacist. I don't know if you do them here or not, but certainly pharmacists stock them, and you can. So that's where you because a lot of people, people have got arthritis or joint problems, or a lot of, unfortunately, people with glaucoma tend to be a bit older, and often they've got other problems, like gripping drops. So yes, there are aids which you can attach to the bottle, which helps make it easy to get them in. So that's quite important.
So if somebody was struggling with drops, where would they go? What would be the best?
Well, I think as you say, if they're in there are, I said, the Know Your Drops. I know Moorfields pharmacists do run this Know Your Drops. I think pre-COVID they were running courses in the clinics, which has probably come to a halt at the moment. They may be doing stuff online. It'll probably be on their website if they do, but certainly the videos are online. So that's probably the first place to start. If they are in clinic at the hospital, then it might be worth talking to their consultant. If they are struggling, they would probably be able to give them advice on where to go and who to see. But certainly I think the website's probably the first place to start. That would be a good starting point.
And so how do you know you've put your drops in right? What are the kind of signs that it's not going right, and what is
if it's all coming down your cheek, you're probably not putting it in right.
Okay.
And would I be right in saying if it's going down your throat,
yes,
it's not going in right either?
Well, it's probably going in, but it's going down, because effectively when you put eye drops in, there's a small little opening in the corner of the eye, and that goes in through the nose and then it goes down to the back of your throat.
So you have to.
So ideally, yes, you're right. So when you put drops in, you would normally want to occlude that. So you put the drop in and you would hold your finger over that to stop it going down your nose. So if you're tasting it,
you're probably
not doing it right. And that is quite important, because some eye drops actually, although you think it's just an eye drop, some of that does get into your general circulation, and you can have some side effects from drops. Some of them can taste a bit bitter as well. So on some of the drops you get quite a bitter taste. So if you and that puts people off taking them sometimes.
Yes.
I had a very sad case where a year ago I think I saw a lady who'd been diagnosed with glaucoma, she didn't like the drops and she didn't like the hospital, so she stopped going. And this was about over 10 years ago, so she'd seen no one for 10 years. She drove to her appointment to see me.
Oh no.
She knew something was wrong, because she said she's in her head because she's not seeing things, so her peripheral vision's gone. She had extremely advanced glaucoma. She had no peripheral vision left, only central vision, so she can't drive now. That's gone. And only, unfortunately, because she didn't like the drops, and she just stopped going. And
she could have saved her vision.
I've seen her since. She's registered severely sight impaired now, and that could have been stopped really just by drops and just complying with treatment. But unfortunately, I think the problem with glaucoma is that because it's so slow and gradual, you don't feel it. Some people go to the hospital. They said, you've got to take these drops. And they put them in, well, nothing's changed, I don't see any better.
That's it.
They're not doing any good.
They're not doing any good, that's what they feel.
Yeah.
And the whole point of taking the drops is to slow down and stop damage. It's not going to reverse damage. It's not going to make you see better.
No.
And actually, you know, the drops might irritate your eyes a little bit when you put them in because they can be a bit stingy. That goes off quite quickly, so that shouldn't put you off. That's what put this lady off, unfortunately, stingy eyes.
Yeah.
And that was the problem.
And is the drop treatment, so to speak, is it really effective? Does it really stop the advancement?
So what we know is that if you reduce the pressure, you slow down change.
So that's what the drops do, they reduce the pressure.
Yeah. Glaucoma is sort of high pressure in the eye, but not exclusively that. There are different variants, so it's not as simple just to say high pressure glaucoma. But if you have got glaucoma, the only proven way to slow it down is to reduce the pressure. And you're aiming for a 20-30% reduction. And if you can do that, it slows it down. And we also know that every little bit you reduce it by slows it down more.
Right.
So if you take your drops every other day, there's going to be times where your pressure's back to normal, probably high. And that's going to gradually cause problems. So it's regular treatment, it's doing it regularly, it's complying, it's remembering if you're on 2 lots of drops, it's remembering to try and take them as you're supposed to. Getting it in.
Just kind of getting into routine.
It's a routine, isn't it? It's just a routine.
I'm going to say this, we're coming up to Christmas. People are going to be going to see families. Possibly routines are getting out of normal. So remember.
I suppose if you're travelling, take them with you, I guess.
Take them with you. And whatever you're doing this Christmas, and we hope all our members have a very happy
Safe
Christmas.
and happy Christmas.
Safe and happy Christmas. But remember, if your routine's changed, don't forget to take your drops.
No, good
They're
advice.
really important.
Yeah, that's good advice.
Yeah.
Do we have any questions, Ola? Anybody has?
I asked the main question, and the other was Jennifer was saying she's had the blurry thing before, and it's very scary.
Blurry vision.
The Charles Bonnet, you mean? Or I think it is scary when you don't know what it is. So that's quite. It is very common, I think, with people with macular.
And the thing is that a lot of GPs don't know what it is, and so people are kind of scared of talking about it to their families.
Very few people talk about Charles Bonnet because they say they think that maybe they're going a little bit, something's not quite right.
And the other thing they found out is that during the lockdown, actually more younger people, younger children with sight loss were actually experiencing Charles Bonnet, and sometimes parents just shrug it off as a kind of something the kids are making up, or they're just playing, and it can be quite scary for kids as well.
Yeah, I know. So going back, just a couple more thick points I thought I would like to talk about is just people booking appointments. I know what's happened, and I think everyone's got very scared with COVID. I've had lots of patients, who are ringing up saying, I don't want to come and see you. Certainly when lockdown happened, obviously hospitals weren't seeing people. I had quite a lot of patients coming in with quite severe pathology eye problems who were sort of putting things off. Wet AMD, I saw several of those during lockdown. So I think probably the question is, if you're having problems, that aren't just normal, mild symptoms of, slightly gritty eyes and things like that. I mean, those things can wait. That's not an urgent thing. But certainly, if you're having problems, then it's important to, see someone about it. I think in the first instance, because yes, it's not that easy, and hospitals, unfortunately, what's happened in the hospital service is that a lot of appointments have been cancelled. So many people who've got appointments have been delayed, and they're waiting for appointments, and people get quite worried about that. And obviously what the hospital tended to do is sort of looked at the urgent people, and they're trying to see the urgent people first and then gradually work through the others. So if you are waiting for an appointment, don't worry, you will get seen. Might be a bit later than you were originally hoping, but you will get seen. But I think the key is if something suddenly changes, then you've got to get that seen as well. Don't just assume that I'll be seen because the hospital will see me at some point, if something happens.
And I think it's really important to say now, we know people are putting off appointments, but we have a colleague, his sight changed in October, and he went to and was seen, and he's having the appropriate surgery on Monday morning. And so if there is something if there's something going on in your eyes that really does need to be dealt with, do go, because they are still able to deal with the really important
and obviously
and urgent stuff.
Yeah, and remember, obviously in all our clinics, in optometry clinics or in the hospital, we're taking precautions, we're all wearing full PPE. I've been wearing a face mask for the last 8 months.
Yes.
Aprons, gloves, everything's cleaned down between appointments. Patients, when they're coming in, they're doing their hands, barriers up. So, it's as safe as environment as it. Probably safer than going into shops and supermarkets. So, it's best not to, and I've seen a lot of people with quite serious problems and saying, luckily they haven't, but I know certainly I've got colleagues who work in the hospital service, and a lot of people aren't coming in for their macular injections because they're scared. And unfortunately these problems, if it's left for too long, damage is done. And unfortunately with eyes, you can, in a lot of cases, you can stop damage from getting worse, but you can't repair damage that's happened. Unfortunately, and that's key. So if someone's having injections or any sort of treatment like that, it's important they keep going with their treatment and don't ignore it. That's quite important. So definitely, if something happens and something's not the same as it was last week or week ago or 2 weeks ago, they should get seen, whether it's funny vision or floaters or anything like that. Another common condition we've seen in lockdown, where people, if you have flashing lights or floats in your vision, it's very important that gets seen quickly. So don't go to your GP about that, because again it'll be too slow. In Croydon we're quite lucky actually. So the way the sort of eye, because obviously we've got very good service in Moorfields, but you can't just walk in. You have to have an appointment to get there. So the way that I would advise people, if they have got concerns about their eyes or any sudden onset problems, it's important they probably see their optometrist first. Now if they have a regular optometrist and they've seen them regularly, it's probably a good idea to speak to their normal optometrist if they've got someone that they see and they trust. But in Croydon there is a list of accredited optometrists I mentioned before called COS, and we do run, if you have an eye test, a problem that's not just your normal, needing reading glasses, or I think I'm struggling to read a bit more now, that's more just a normal eye test. But if someone has an acute problem, as in sudden onset, vision change, flashing lights, floaters, pain, sudden redness, light sensitivity, so if they're like, that light's really bright and that's not a normal problem, then it's important they get seen quickly. So all of the opticians, we can put the link on our website, on the Facebook Live site, and the best thing we'll do would be to ring one of the opticians on that list. Say if they have a regular one they go to regularly, then choose that one. If they haven't been to one of those on the list, then I would suggest they go for the nearest one, geography-wise, less travelling, and explain to them what their problem is, and then we would book an appropriate appointment for them to be seen. And sometimes that might be on the same day if it's an acute problem, or within a week or so if it's a less acute problem. And what we tend to do is we would triage the referral. So if someone rings up with some symptoms, we would jot those down. My reception team would then show me that triage sheet. I would look at that and say, well, that's fine, we can see them next week, or no, that needs to be seen today or tomorrow, and then we would make the appointment. And then hopefully, if everything's okay, we would reassure and sort the patient out. Might need to prescribe them drops in some cases. If it's an acute problem, like if it was wet AMD or something like that, we would then refer them into the appropriate clinic, and then they would get seen in the right time frame. And really, people shouldn't put off these sort of things if they've got problems like that. It's important that people get seen.
Thank you, David. I think it's really important that people get reassured and know then what to do. I think
it's
a lot of
where
people
to
just
go, I
don't
think,
know.
at the moment, isn't it?
Yes.
Especially in lockdown, people just were scared to go anywhere. And so I think the best advice I could say is if you have a problem, go and see someone about it. Really, I think is the correct advice.
Excellent. Ola, do we have any other questions?
No.
Okay. Now remember, if you think of questions in the future, next week or tomorrow, do email them to Croydon Vision, and we'll pass them on to David.
happy
And
to answer those.
so if you have questions, don't hesitate to ask. He's here to help us, so don't hesitate. Okay, I think that rounds up all your sort of the talk on different eye conditions, eye health, and that was
very much for doing that.
Pleasure.
It's been really
Nice to be here.
interesting.
Good.
And really
Hope it's been of some
interesting.
interest.
And so, what I wanted to sort of tell everybody about is about Accordion Vision's Christmas fundraising, No One Left Behind, and it's about fundraising to help us bring Christmas lunch, Christmas dinner to our members who are at home alone and who perhaps cannot have their family come to visit them this year and can't travel. And because all the services are closed, people are alone at home, and a cheery Christmas hot meal delivered to them is something that I think will make a huge difference. And we are giving like the choice of fish, meat, a vegetarian and a pudding, and it's delivered to their home nice and hot on Christmas Eve to give them a bit of festive cheer and support. So we wanted to thank some of our organisations and people who have donated, who have been really generous, and we'd like to really thank them. And so it might not be everyone, but between me and Anna, we're going to go through a few lists. So I have here Rajan Amin. Thank you very much for your donation.
And thank you very, very much to Day Lewis Opticians.
And we have Capital Space.
And then we have Gordon Bull.
And we have quite a few of our members as well have been very generous and have given for this fundraising No One Left Behind.
Yes. And finally, we have the COS that we've been talking about, the Croydon COS, which is the complete ophthalmic services. I think I've said
That's
right. Services. And we just both my Odette and myself want to say a big thank you to the many more people who have donated to our funds. Thank you all.
No, thank you very much.
Sorry, one question.
Yes.
A cornea with recurrent rips, is it at risk of COVID?
Sorry, say again?
A cornea with recurrent rips.
Probably like recurrent erosions, maybe where the cornea gets damaged slightly, and then you wake up in the morning, it literally opens the eyes, and it can sort of rip again. So normally we would suggest putting lots of lubricant drops in at night before you go to bed, like a thick lubricant. I don't think it would make you more liable for COVID, to be honest. It's more likely to give you a sore eye and quite painful sometimes. As far as COVID, I don't think it's going to make you any more liable to get COVID, no.
So it's not like an open wound or something?
Very mildly, but it's a very, but it's quite painful because the cornea is very sensitive.
Right.
So normally you would suggest putting a really thick ointment in before you go to bed to stop the eye sticking. And then in the morning what happens is you wake up and it rips. So that's why you want to try and stop that from happening.
Yeah.
So ointment before you go to bed stops the eye sticking. In the morning, hopefully you should be all right.
Okay, thank you.
Keep
the questions coming. Keep them coming.
Keep the questions coming.
And I'd like to also introduce next week's Facebook. So we're going to have Aisha's going to be doing some Christmas baking. So do come and join us next week for some more fantastic food from our cook from Aisha at Croydon Vision. And thank you again, David, for joining us today.
The comments just keep coming in.
Late comments.
We've got one more that she said.
Yes.
I think it's more of a compliment because it said she had to go to the retina clinic during lockdown and Moorfield was brilliant.
Yeah.
And then
great
was
to know.
asking if there was a phone number for Moorfield, if anybody needed to call.
We don't have it here, but we can definitely
They have a helpline, so
Yes.
you can ring, which is like a nurse-led helpline. So if people have got queries, again, it'll be on their website. You can definitely have an advice line, which you could ring in the first instance, and they would probably point you in the right direction.
And for those people that don't use the internet, I'm sure if you phone up I'm sure that either
Glenn,
whoever is
yes.
in at the time will help you to find that.
Yes.
If Glenn is in, he will do it, but we do know that Glenn needs to have a little bit of time off. So I'm sure one of us will help you.
Yes, we'll be able to pass on the number. It's good to know that there's a nurse and that there's sort of a helpline at Moorfields, because
Yeah, certainly in lockdown, as I said, obviously where people can't go in or couldn't go in easily, then a lot of telly. I mean, I was doing a lot of telly calls from work to people at home, so that was quite common. So I mean, Moorfield switched to a lot of telly stuff as well. I mean, there's a limit to what you can do on a telephone call, but you can do some things.
Excellent. Thank you very much.
Yes.
And so see you next week then.
Thank you.
See you all next week. Bye.
Bye.
Bye.